Access Minnesota. Issues that matter to you. Access Minnesota brings you the newsmakers and the stories that shape our everyday lives, with analysis from University of Minnesota faculty experts.
Welcome to Access Minnesota. This month we devote the entire show to the H1N1 and seasonal influenza. Both diseases now are circulating throughout Minnesota, and the diseases are widespread. Joining us is Chris Erzman, the director of the Infectious Disease Division of the Minnesota Department of Health. Chris, welcome to Access Minnesota.
Thank you.
When we talk about influenza, the first thing we should probably differentiate is talk of the flu. People often say I have the stomach flu. That's a very different disease than influenza. Why do we confuse those two diseases when we talk about the flu?
Well, I think that the term the flu has come to mean anything sort of rotten that comes over you. You didn't feel well over the weekend, you come back to work and say, I had the flu. And that becomes confusing then, because when we talk about influenza, we often shorten it to the flu. But when we refer to influenza, both seasonal and H1N1, we're referring to an upper respiratory illness. And so when people think of the stomach flu, they usually think of symptoms that include vomiting and diarrhea. And those are separate from influenza. Upper respiratory symptoms would be fever, cough, runny nose, sore throat, muscle aches, body aches, headaches, that kind of thing. And so it's important that people differentiate, because I think a lot of times the effectiveness of the vaccine and understanding about flu gets mixed up, because people think, oh, I got the vaccine and then I had an upset stomach, or I had diarrhea or vomiting afterwards, it didn't work. Well, in fact, that's not what it's protecting against. We're talking about an upper respiratory illness.
Now, last spring there was a great concern about what was then called swine flu, now referred to as H1N1. Why do we move away from using the term swine flu?
Well, initially that term came about because the virus that is causing the illness is a combination of human, swine, and some avian influenza pieces or components. And so that was sort of an easy way to refer to the illness. But unfortunately, it confused a lot of people. And so they interpreted swine flu as being something that was associated with pork products. And so that had a devastating impact on the pork industry. It's absolutely not correct. There's no concern with eating pork. It's completely safe. But it had that impact. So we felt it was important to really refer to it by its technical name, which is H1N1 novel influenza, to be more precise, so the public wouldn't be confused about the safety of consuming pork products.
Now, we talk about seasonal influenza. Does the disease change every year? Are we always looking at a different strain of flu? How does that change from year to year?
Well, the influenza virus, and it's sort of the hallmark of this disease. It has the ability to sort of reinvent itself every year. It's constantly changing its antigenic or disease-causing parts. And so that's why every year we have a new influenza vaccine, because the virus has the ability to make these small changes to try to evade our immune system. What happens in the case of a pandemic, or in this case with this novel H1N1, is the virus changes so much, so significantly, that it is completely new to our immune systems, and so we don't have any protection. So we're talking about something that, while it's the same technique, if you will, of the virus to change itself, it's doing it at such a great level that it has a much more significant effect than just a seasonal strain change.
And for the benefit of our viewers, let's talk a little bit about the differences between H1N1 and the seasonal influenza. Are we more concerned about H1N1? Is it more virulent than the normal seasonal flu?
Well, in general, when you have a new strain, a novel strain, or a pandemic strain, what's unique about that is that the human population hasn't had any experience with it. So our immune systems are completely naive. We haven't experienced this before. We don't really have any immunologic protection. And with seasonal influenza, although the virus changes every year, we still have some background protection, which sort of cushions the public, if you will. So our concern with the H1N1 is because it's a new strain or a novel strain, you don't have any protection in the population. And so it has the potential then to be very serious. And I think people, when they think of pandemics, often hearken to 1918. And that's sort of the far end of the spectrum. That's the most severe. And so, we've been preparing and anticipating, could this be as serious as that? It doesn't have to be, but certainly we have to prepare for that. And so that's why a pandemic strain or a novel strain causes more concern than a seasonal strain, just because we don't have that protection. In this case, this year, what's different with the novel strain from the seasonal is that it's affecting different people. It's affecting younger individuals rather than the elderly. And so that's what's different with this strain.
We talked about H1N1 or swine flu back in the spring. I think some people got very complacent and thought, well, this didn't turn out to be the terrible thing that we anticipated. Is there a better chance now that we're going into the fall-winter flu season that indeed this will be more concerning this time around than it was in the spring?
Sure. Well, in the spring we didn't have any idea how it would present itself, and in fact, while the public perhaps felt ho-hum, it wasn't as bad as 1918. I think everyone in the healthcare and public health fields was delighted. I mean, no one really wants to see a repeat of a very, very severe pandemic. But what we've been preparing for and what we want to be cautious and watch for this fall is that we have seen in the past that a virus will present perhaps in the spring and be more mild, and then have the ability to become stronger and more severe in the second and third waves, which is what we're in the second wave this fall as disease is occurring. So we want to watch for that. That doesn't mean that will happen, but again, the importance of vaccination, the importance of some of the preparedness work that is being done is all to be ready in case the virus does become more and more severe. And as I said, that has happened in previous pandemics.
And Chris, how rapidly is H1N1 spreading across Minnesota at this point?
Well, we use different measures to kind of get a handle on what's happening in the state. And with any disease like influenza, where it's very widespread, we're not able to count individual cases. But for instance, this fall, what we're looking at is we're using schools as an indicator of community transmission. And so we've seen that as schools have started again, we've seen reports of illness in schools, and that the number of schools reporting illness has increased. So we know based on that we have widespread transmission of H1N1 across the state, that all of our regions are experiencing H1N1 disease.
And Chris, if you had an elevator speech to give to someone about what they need to be aware of regarding H1N1, what would that be? What are some of the key things that people need to know about that disease?
Well, first of all, there's lots of things that you can do to protect yourself. So I think that would be what I'd want people to know. And first of all, you can protect yourself and others by staying home if you're sick. That's really important. The second thing is to practice good respiratory hygiene, which is basically to, cover your cough into your elbow. That way, you don't touch your elbow, you're not going to spread germs that way. Good hand washing is extremely important for this and many other infectious diseases. And then the fourth is, as the H1N1 vaccine becomes available, to take advantage of that and get vaccinated. Those are sort of the four important things that people need to keep in mind in terms of protecting themselves.
And Chris, we have a lot more time in the show to go over those things more specifically, and I have a lot of questions for you. We need to take our first break. We're talking with Chris Erzman, who is the director of the Infectious Disease Division at the Minnesota Department of Health. We're talking about seasonal influenza and H1N1. We'll be back in just a moment.